Good morning, everybody. Welcome to Facial Plastics Friday. It's Dr. Brace here early in the morning. And today I'm going to continue with the rhinoplasty series, discussing the difference between an open versus a closed rhinoplasty. This is sometimes referred to as an external versus an endonasal rhinoplasty. And so what's the difference? Well, an external approach rhinoplasty is when we make an incision right here. That's called the columella, that fleshy part there. So an incision in the columella, and that can either be a stair-step incision or a inverted V incision. So it comes across, up and down, and back. And I'll show you an example of that in the OR. And the reason why we break it up with a stair-step or an inverted V is because you don't want a scar to contract and pinch your columella and distort it. So by making angles in the scar, you can prevent that from happening. It also helps camouflage the scar when it's not a straight line. So once you make that incision, the incisions continue on the inside of the nose and allow us to remove the skin to lift it right up off of the cartilage and the bone so that we can access them and manipulate them, trim them, reshape them to reshape your nose. All of those maneuvers can be done endonasally or closed. It's a little more tricky. And I find in my hands, I have more control of the tip if I open the nose. And so my decision to either open someone's nose or do it closed depends on what they want to have done. As soon as we're talking about tip work in terms of changing the shape and size of the tip, I will open the nose. If we're talking about taking a bump down alone or a bump down with a tip repositioning either up or down, rotated up or rotated down, or into the plane of the face, that's called a deep projection, or projected out from the plane of the face, projection, I can do all of that quite reliably through an endonasal or a closed approach. And so I want to show an example of both of these approaches today. So here's a video of the incisions to make an open approach septorhinoplasty. Again, these are just approaches, so you can accomplish everything in a rhinoplasty from either approach, but for me, I find it's easier to do tip work with an open approach. You can see there's incisions on the side of the columella, and then there's an incision, like we talked about, an inverted V incision on the front part of the columella. And then I use a small little skin hook, and we lift the skin up, and then using some very sharp, fine scissors, I will dissect on the cartilage of the tip and continue the incision in the nose along the undersurface or the bottom edge of the alar cartilages, the lateral crura of the lower lateral cartilages. Once that's completely opened up, we then elevate the skin and the soft tissue under the skin off of the cartilage all the way up to the nasal bones, and then we can see everything. And so that is an external approach. I've drawn the subunits on the nose here, or the cartilages on the nose, and you can see the ala are marked out as those long ovals on the skin. And when we lift the skin, you can see what they look like underneath. And put the skin back, you can see that the markings I made on the skin actually are complete tracings of the cartilages because this patient had thin skin and I could see all of the edges quite readily through their skin. So with an endonasal approach, this is different. We make all the incisions inside the nose. So an endonasal approach can be done a number of different ways. The way I like to do it is something called an intercartilaginous incision, where I make an incision between the lower lateral cartilage, the lateral crura, and the upper lateral cartilage, and this allows me to sneak up on top of the septum and on top of the cartilages and on top of the bone from the inside of the nose. And so I'm going to show the incisions here, and this is where we make them. And then once we have that done, we can take the bump down and I can change the position of the tip. So I hope that helps you understand the difference between an open and a closed rhinoplasty. Remember, they're just approaches to the nose, but you can accomplish anything you want through either approach. It's just that surgeon preference for me is that an open approach is easier to do tip work. An advantage of doing a closed rhinoplasty is that you get less numbness and swelling in the tip, but a disadvantage for me is that I feel like I don't have as much control. An advantage of an open rhinoplasty is that I have complete control of the tip, but there's more swelling and more numbness that will take about a year to come back to normal sensation and normal appearance. So everybody have a great weekend. Enjoy this summer weather. Happy Facial Plastics Friday.